Okay, I think we can start getting ready to get started. Yeah?
Yeah.
Thank you guys all for being here. My name is Kirlos Haroon, and this is Mackenzie Warshall. And in the audience front row, we have Dr. Linda Regan as well. She will be kind of giving us all the educational opportunities today to talk through this presentation. This is game day in the ED. And here we want to kind of introduce this new tool for you guys, a strategy for skill retention that is mental practice. So we'll be sharpening our skills with this idea of mental practice. So to put you in the sense of what I'm talking about, I want to kind of bring to mind this show I've been watching recently, Drive to Survive on Netflix. It's a pseudo documentary of Formula One racing, and in season 3, there's this character Esteban Ocon. He's one of the big racers. He's about 20 years old, and he describes this thing he does every day, where he closes his eyes, he puts his hand on the wheel, and he'll run himself through his entire race day. He'll switch the gears, he'll make the turns. And in Drive to Survive, they overlay him in the race and at home doing the exact same turns to the right, to the left, really perfectly executing the moves. He does this to kind of practice his daily routine of really visualizing his race. I wanted to have a video, but Netflix would sue me for 4 times my net worth if I try to kind of take their footage. So here's a QR code of a correlate. Red Bull Sports on their Instagram page has a Motor Grand Prix, or rather a motorcycle racer who is visualizing his race through the course. And you'll see him kind of turning and kind of really bringing his entire body to visualize his race. This is something done at the highest level of sport. And today, this idea of mental practice, we're going to bring it to the emergency department.
So, thank you so much, Carol. We have no disclosures. Our learning objectives today are to describe what mental practice is. We're going to identify.
This
It's
is the
it's
video.
a great video.
This is the video. Yeah, we set you up for failure. We're sorry. That's
But it really is a great video. We're going to identify the evidence base behind mental practice. It's mostly seen in the sports psychology and neuroscience. And then we're going to give you the tools to be able to use mental practice in your own daily routines. So, on to our journey. We're going to once again, what is mental practice? We're going to define the evidence, and then we're going to give you the tools to implement this in the emergency department. Now, I want to introduce you to my very close friend, Mental Practice Mary. I preface this with every time she is on, we are going to have questions, and I would love participation. Full disclosure, I am 8 days postpartum, so I'm emotionally labile. So if you do not participate with me, I might cry. Just so you know, Johns Hopkins has great maternity leave. I'm choosing to be here. But when you see mental practice, Mary, please answer my questions.
So let's get going, right? What is mental practice? This is kind of what we're going to be diving into rather to start. And mental practice is this idea of cognitive rehearsal of a task without physical movement, right? It is some concepts that overlay with mental practice is mental imagery, mental rehearsal, and sometimes visualization. And really, it's a process of mentally imagining or recreating a step-by-step task using the kinesthetics, the cognitive rehearsal, and then the emotions of the task, sport, or procedure. Really, I break it down into these 3 things. I think of it as the mental imagery, I think of it as the kinesthetic portion, and then I think of the emotions. And this all comes together as the deliberate process wherein you engage in mental practice.
So let's practice for a second. We're going to do an intubation. This is ChatGPT, what they think I look like, a little bit better jawline than I actually have. But you can keep your eyes open or closed. The first part is your mental imagery. Picture yourself in the critical care bay. A patient's coming in respiratory distress. You have your RT at one side, you have your BiPAP machine, you have your nurses, your telemetry, everything's ready. Then imagine your emotions. Your heart is racing, you're really stressed out, you can barely breathe, you hear the pulse ox going down, there's lots of commotion in the room as everyone's trying to get blood and other products and everything ready. And then the scenario. Your hands open the mouth, you get a grade 1 view. Tube goes in, color change on the end title, bilateral breath sounds, you can finally breathe. So we know that physical practice is best, but we can't always have physical practice. There are many obstacles. In the sports literature, this is weather, fatigue, injury. In emergency medicine, this is cost. Do we have the amount of money to get mannequins? This is time. Are you really going to send your trainees to another simulation when they're already working too many hours this month? Patient safety. The best person should be doing the procedure, so sometimes that doesn't always allow certain people to get certain procedures. And then other obstacles, like when's the last time you've done a transvenous pacer? So when can you do mental practice? Anytime, anywhere, any procedure. Okay, mental practice Mary is entering the chat. Can you recall a situation in which mental practice helped you perform a procedure? And you might not even think you've done it, but maybe setting up your central line kit, kind of running through what you might have done right before a central line. 2 hands up. Hey! Well, look at that. Thank you for participating.
So now let's start talking about the evidence base. Here for the evidence base, we're going to be looking at sports, psychology, neuroscience, and really medicine overall. And really from sports, we have two areas that we kind of reference, these ideas of closed skills and open skills. First, closed skills. When I think of closed skills, I think of a gymnast performing a routine in a predictable, controlled environment, right? It's their routine, their task, their space. And the question is, what about the medical example? The medical example of a closed skill would be a sterile, ultrasound guided IJ central line, right? It's your space, your kind of region. You have control of the environment. And in this space, kind of the evidence in sports tells us closed skills with mental practice helps you refine your technique, helps you enhance precision, and improves the consistency of your performance. So that's closed skills. Within sports, the idea of open skills, an example would be the soccer player, right? We know we have a certain amount of skills that certain soccer players will engage in, but there's other aspects to that environment, right? For a shout out, this is Mo Salah in Liverpool. He's an Egyptian like me. And he, right, his shot is perfect, but he is practicing an open skill where there are other players, there's other environments, there's other factors playing into that environment. And for me, an example of that in medicine is the unstable intubation and the vomiting patient, where you might pivot towards a salad technique or Crike possibly, right? Here, mental practice helps us improve decision making, helps us improve adaptability, and helps us visualize various scenarios. So we have this body of evidence within sports that tells us closed skills and open skills both benefit from mental practice. But it goes further than that. Mental practice also is more beneficial in cognitive rather than reflexive skills. When I say cognitive skills, I mean multi-step, really involved skills, such as a transvenous pacer, for example. More so than reflexive or one-step skills like a blind peripheral IV. Further, mental practice it really actually works well with experts rather than novices. You can apply it to both spaces, but experts who know a task can really engage further with mental practice. From there, our friend Mental Practice, Mary, is back with another question, okay? Raise your hand. Raise your hand if you expect the brain to process mental practice in physical execution along different neural pathways. No hands? We got one hand. We got one hand coming up, okay? We'll see the answer to that right now.
Looks like most of you did not get tricked by Kiro, but before we go into that, I would like to discuss the literature. So, this idea of motor imagery versus motor execution. Your motor imagery is your thought process. Your, I want to intubate, I'm going to intubate. Your motor execution is actually doing the skill. So, that's your physically doing something. And that allows you to actually get neural feedback. So, you go to intubate, you accidentally intubate the esophagus. It happens to all of us. But you recognize that you did not get a grade 1 view. So next time, maybe you pull the blade back and you get a better view to intubate where you're supposed to. This is that neural feedback that you get with motor execution. Now, I would like to look at some fMRIs, beautiful pictures. So we have motor imagery at the top, action observed, which we'll discuss in a second, and then movement execution, which is the same thing as motor execution. And as you can tell by our pretty colors, the motor imagery and the motor execution actually work in the same parts of the brain. So you'll see frontal, parietal, subcortical, and cerebellar activation, whether you're doing motor imagery, so you're going through it in your head, just like we did earlier with the intubation, or motor execution, actually performing the intubation. Now, a side note for our senior residents and faculty in the room, action observation does some of these parts, but not the subcortical and cerebellar region. So don't give all of your procedures away because you still need to practice them sometimes. Now, there are technical and non-technical skills. Most of the data that we have in healthcare is done in the surgical field. So our technical skills are things like an incision, suturing, intubation, cric. Our non-technical skills are resilience, teamwork. We're going to dive into the technical skills for this talk. Okay. There's a lot of words on this page, so I'm just going to summarize. There was a large meta-analysis done in 2015 on 9 randomized control trials on mental practice. This was done on technical skills, anywhere from an incision to cric, so a large variety. And we saw that there were 4 neutral results and 5 positive results. Now, what we get from this, there were 500 participants, looked at all of these things. Half of them had mental practice training and half didn't. In the neutral results, they might have had 1 session, a very short session of mental practice, and okay, that's fine. But in all the positives, we saw that they had numerous different sessions and longer mental practice training sessions.
So when looking at that data, right, initially I thought, well, the data is mixed, right? We have some neutral and some positive. But when I thought about it more and more, I realized the data, when really dug into, actually reveals kind of features of what makes mental practice more effective. Right? The data really tells us longer duration is better, 20 to 30-minute sessions. It tells us spaced repetition or deliberate practice for the educators in the room is kind of the best way to execute this. It tells us that senior kind of educators, or rather learners, will benefit from this more than novice learners. It tells us that cognitive tasks, what we mentioned earlier, multi-step tasks will benefit from mental practice more than reflexive tasks. And finally, this idea of mental practice scripts starts coming into the conversation when you look at the literature. I want to pause and say that getting more of these into your mental practice kind of behaviors is better, but sometimes you don't have the opportunity for all of them. So if it's 5 minutes before kind of a high level trauma coming into your ER, and you want to quickly practice for 5 minutes, yes, it's not 20 to 30 minutes, but it's something. The more you can get in to your rhythm, the better. And from there, let's start diving into implementation. What are the best practices for implementation and future directions in this field of mental practice? But before we dive into that, I want to start with a question. Raise both hands if you have done a cricothyrotomy. Okay? Keep your hands up. Keep them up, please. In the last 3 years. Okay, some have gone down. In the last year. Okay, some have gone down. In the last month, I see no hands, right? This is where we're thinking about when we're talking about mental practice. A recent systematic review says it very clearly. Mental practice is useful in augmenting learning strategies for the retention of knowledge and skills and high acuity, low occurrence procedures where reproducing the physical skills are just not an option. And really, our target here is skill decay. It's for our kind of educators or learners who have reached optimal competency, but then as their skills fade over time, they can bring in mental practice to bring them back up to optimal competency. This staged, deliberate practice that occurs over time. The question is, how do we engage in it? How do we engage in mental practice? And really, the answer is this idea of mental practice scripts. Mental practice scripts is the tool by which you can reliably engage with yourself and learners in this idea of mental practice. How do you create mental practice scripts? There's this idea of verbal protocol analysis. For the educators in the room, again, this is a form of the Delphi method, where you get content experts to come together and describe a procedure together. They combine code and they bring their thoughts around a procedure, and then they can develop this idea of a mental practice script. Let's talk about an example.
So we have here an erector spinae plane block example. Please don't mind the colors. I did not choose them. They come from the literature. If you can get past that, you can see the actual importance of the colors. So we have 3 sensory clues for every mental practice script that you would have. The red here is visual. It's that visualizing you're in the trauma bay, visualizing you have the respiratory therapist nearby. Then you have the kinesthetic in green. The importance of, using your two fingers, opening the mouth, looking at the blade. And then you have your cognitive in yellow, going through the steps. How would you go by if the vomit comes in or if the patient starts hemorrhaging when you're doing your intubation? Although these colors look terrible, they are all very important when making a mental practice script. So, what scripts exist in emergency medicine? I'm sorry, we don't really have many. There are 2 currently, thank you, 2 currently, both by Dr. Riggs et al. In Canada, one on a crike and the other on doffing and donning in COVID PPE. We're gonna take that away from our brain and not give us any more trauma from COVID, but we need to do better. There's clearly a deficiency in mental practice in emergency medicine, and so I'm gonna give you guys a little bit of homework. Sorry. Our future steps here are we need to make these mental practice scripts with FOAMed on blogs together. Then we need to apply them. We can use them maybe for remediation for our residents who maybe didn't do so great on a procedure, but we don't have time to take them to a sim lab, 5 minutes at the end of shift during feedback. And then we can investigate. Did this improve patient outcomes? Did it improve your learner's confidence in performing these skills? So, my last mental practice, Mary, we have homework. Do you think that you could implement these in your own programs? Do you think you could create a mental practice using like a modified Delphi with some of our expert learners that I'm sure we even have in this room? What barriers do you see in implementing mental practice? I know we teased you a little bit, but we are going to give you some tools. Here's a QR code introducing the PETLEP theory of how to create a mental practice script.
We'll keep this on the screen. This is a kind of our big takeaway. In 20 minutes, we tried to squeeze in as much information about the value of mental practice, but that next stage of kind of implementing it, it's really going to be something that we're going to give you to take home and really think through. In the QR code that you're looking at right now, you have the PETLEP model of how to create a mental practice script, as well as an annotated bibliography of a lot of the data around mental practice and kind of the value of it in sports, neuroscience, and kind of everything in between. That is what we have for you. Thank you guys so much for being here. We have 2 minutes. We could take a question, or we can kind of move on from there. Okay.
No questions.
Thank
I'll
you
go back
guys.
to the QR code. Just
We'll
in
keep the
case
QR
anyone
code
got
up for
it.
you guys. That's it. Thank you so much, guys.
Nice.
That was nice. That was smooth.
I like the transition. The transition was
Yeah,
good.
yeah.
That was good vibes. Huh? Thanks. He's over there. I can run away. Thanks so good. Thanks for coming. How are you feeling? Pretty good. I'm a little tired, but
Can we take a group
picture.
photo? Let's take a photo with everybody.
yeah.
Could you? Yeah.
Oh yeah.
Johns Hopkins. We're gonna take a group photo up front. Johns Hopkins people.
John's. Will you take a photo? You want me to hold it? He can. We can maybe scooch the cars again.
Guys, come up here. Come up here. We gotta
The
get.
pictures of you and him at
Yeah.
his first conference one weekend.
Yeah.
Great. I don't want to be around on the podium.
Guys, come up. Come. More. Should we go on the right side or whatever? This group. Oh, can you?